Okay, Dee, thanks for taking some time to speak with us. I first met you back in April, and at that time I was going over your notes. You said that you had had headaches since your 20s. They've been pretty bad. Had a couple operations about that, for that reason. Can you tell us a little bit about what your headaches were like at the time?
Well, I've always kind of suffered from migraine, and as the years went by, then it began to be so debilitating, the pain, and I mean the kind that just you could not function. Spend many days, most days, laying on a couch, taking all kinds of drugs, including morphine and different patches and things like that to deal with it. Been through all kinds of pain management and epidurals, all the different things that they would try at the time, and nothing really helped. And as a result of that, I ended up having a 5-level fusion in my neck, which did relieve some of the pain for a while, but still had migraines, maybe not quite as bad, and then as the years progressed, they became more and more severe. And orthopedic doctor said really nothing could be done. The neurologist said, migraines, there is no cure, and just everything was meds, which weren't helping.
Right. Now that level fusion was in 2002,
Yes.
and when I saw you in early part of 2013, according to my notes, you were still having about 20 to 25
Yes.
migraines a month, and they were a 10 out of 10 and lasting, according to my notes, anywhere from 12 to 48 hours at a time,
Yes.
right?
They had gotten that bad again.
Okay, so we thought you might have occipital neuralgia, and we blocked a number of nerves in the back of your neck.
That's correct.
And you got almost complete relief for a few hours, right?
Yes, I did.
Okay, so we then decided to have surgery and then release those nerves, and a couple of those very tiny nerve branches were actually maybe from your prior surgery, maybe just because that's how you were built, and scarring and so forth were damaged, and so we cut the little small nerve branches and implanted them into the muscle. What was the recovery from surgery like?
It really wasn't that bad, I have to admit. That certainly for a month or so, surgery soreness and an occasional headache. And then as time went on, got to the point that I was not having those kind of migraines where you just had like a stake driven into your eye and, just couldn't function at all.
Right.
And had some hypersensitive nerve stuff on the back of my head when you would try to lay on it at night and that. And that has gotten better over time as well.
Okay, so you're now 7 months after your operation, a little less than 7 months. What are your migraines like now?
I'm not having what I would call the kind of migraine that I had before.
Okay.
And if I have any kind of a headache at all, it might be just from the sensitive nerves, and that would be when I wake up in the morning, and once I'm up a while, even that goes away. So I'm really not having those migraines.
Right. So would you do this again if you had to?
Absolutely, in a hot second. I
Okay.
would, yes.
Thanks for
Yes.
speaking with us. Appreciate it.
You're welcome.